Hello everyone, my name is Christopher Thompson and this is my presentation on Senate Bill 644 for Class 540 with Dr. Beth Scott. Senate Bill 644 focuses on expanding the availability of methadone through pharmacies. The goal is to make methadone more available in unsupervised use scenarios in order to treat the opioid use disorder and the opioid pandemic across the country. The bill focuses on restructuring and removing portions of the Controlled Substance Act that required qualified practitioners, such as addiction specialized physicians or addiction medicine certified physicians, and nurse practitioners to have a specific DEA certification to prescribe methadone. This removal of restrictions would provide much needed support to more rural communities that do not have access to addiction medicine clinics and treatment plans. In the past year, we've had a total of 73,838 overdose deaths related to non-regulated opioids, not including methadone. Continuing with the bill, the main composers of the bill are Bernie Sanders, Mike Braun, Margaret Hassan, Cory Booker, and Rand Paul. Currently, Senate Bill 644 is in the process of being reported to the full chamber. Next, the bill must pass through the House and then be signed by the President. The committee responsible for this bill is Health, Education, Labor, and Pensions. The elected official I chose to communicate with and cover was Mr. Chase Tremont. He is a state representative for District 30 of Florida in the State House of Representatives. Elected to the Florida House of Representatives in 2022. He lives in Port Orange, Florida. He was born November 9, 1979 in Daytona Beach, Florida. And he has worked as a school teacher, and then he moved to being a head pastor before he was a state representative. Chase attended Flagler College, where he earned 2 bachelor's degrees, the first in communications and the second in history and education. Now moving to the literature review, the first article I chose was a qualitative study design. This study utilized purposive sampling. Participants were enrolled from individuals attending the methadone clinic for over 2 years. Semi-structured interviews were used to collect data on substance use and experience before and after methadone treatment. The results showed that individuals before methadone treatment were experiencing adverse effects on health, legal problems, and family dysfunction. Experiences with the care of methadone treatment included benefits such as improved health, family reintegration, and then stigma reduction. Common barriers to treatment included transportation issues and financial constraints. The second article chosen for the literature review investigated the interactions between arrests for technical violations versus receiving new charges when receiving community-based methadone treatment on time to re-incarceration. In a sample of 788 men, 29.4% received technical violations with no new charges and were reincarcerated, and men who received methadone treatment had time to reincarcerations that were 50% longer than other opioid use disorder fellows that were in the study. So basically what it's saying is reducing the technical violations may enhance the benefits of providing community-based methadone treatment following the release from incarcerations during that vulnerable time post-incarceration and reduce the burden on correctional systems. The third article covered pharmacy administration and dispensing of methadone treatment for opioid use disorder, and it may help to address the inadequate capability of opioid treatment programs in the U.S. by expanding the access to methadone to community pharmacies nationally. This study had 20 patients trial run, pad bound or the prescription through public pharmacy of methadone, and the study stated that the biggest factor noted in was the convenience being the biggest factor. They didn't have to drive 3 or 4 hours to an opioid treatment clinic. Many small rural communities do not have a readily accessible opioid treatment program that they can attend. The fourth article is a systematic review and a network meta-analysis of a randomized controls trials aimed to report the effect of psychosocial intervention for opioid-dependent people receiving methadone treatment in outpatient clinics. The cognitive behavioral therapy and educational behavioral counseling were more effective than the treatment as usual in the efficacy. Concluding that educational behavioral counseling and cognitive behavioral therapy appear to be the most effective psychosocial interventions for opioid-dependent people receiving methadone and maintenance treatment. It's important to realize that other forms of treatment are very beneficial to those receiving methadone treatment, and making methadone more accessible does not mean that receiving methadone will have the same results as someone receiving methadone in combination with psychosocial therapy. One of the benefits to the improvement of telehealth and the approval of more telehealth reimbursement is that these people can get contact with somebody who is a cognitive behavioral therapist or a educational behavioral counseling specialist who can help them create a plan to reduce their dependence on opioids, and it can help them live a more active and have a much better outcome than just taking the drug on its own, because it's like it's shown to be more effective in combination with therapy and medication relief. The fifth and final article I chose was a cross-sectional study of 276 primary care providers who were medical doctors, PAs, nurses, pharmacists, and dispensing staff in northern Vietnam. The aim was to investigate factors related to the confidence in providing methadone treatment among primary care providers. The results of the study were applicable to the topic because it identified that providers with more accurate knowledge of methadone treatment perceived less stigma of working with drug-using patients and reported more work-related support than those without confidence in providing methadone. So if America is going to follow suit with this widening access to methadone and methadone therapy for opioid use disorder, we need to follow suit and to adequately train our family care providers who are going to be certified and able to prescribe methadone so that they can feel comfortable in the treatment process, and it can remove the stigma of working with drug-using patients. This article highlighted areas where methadone access has been expanded to primary care facilities, educational resources. To improve primary care providers' confidence would be of great benefit to professionals. Continued training and support at work for providers is essential to ensuring quality and decentralized methadone treatment. So the United States would probably greatly benefit from following suit and providing the adequate treatment and support to these providers so that they can feel confident in treating these patients, because it is a widespread problem. This was my letter I wrote to Representative Tremont. You're welcome to read it. Go ahead and pause it right now. I won't bore you all and read the whole thing, but pretty much I highlighted the benefits of methadone, and I pretty much said it's no great secret that America has an opioid crisis on its hands. Many people have family members or are currently struggling with opioid use disorder. It destroys relationships, finances, and careers. Methadone has been proven is a proven treatment to help improve the detoxification process. Many people, previously being a minister, I know that you have seen and heard of many people struggling to break free from addiction. The National Institute of Health estimates that 73,838 people will die from overdose of non-regulated opioids this year. Currently, methadone can only be prescribed by specially certified providers, addiction medicine certified providers, and it must be given under supervision in an opioid treatment program. Many more rural towns and small cities do not have opioid treatment programs available or that can meet the need. The bill will allow for pharmacies to dispense methadone to those who do not have access to addiction treatment plans. And I go on to highlight the importance of telehealth and the importance of including psychotherapy and cognitive behavioral therapy and educational counseling for these patients in order to create a plan and hold them accountable for decreasing their opioid use. I also then state that there's very little difference between the percentage of those struggling with opioid use disorder between rural communities and large cities. So in rural communities it was 3%, and then in large cities it was 3.2%. So really the need for opioid clinics, opioid use treatment plans and programs are just as high in rural communities as they are in the city. They're just not as many people to support the demand. Application to advanced practice. I just had some bullet points here. Advanced practice providers need to advocate for their patients in our extremely complex healthcare system. Many patients do not have an adequate understanding of the medical system in America to make knowledgeable decisions. This class has given a broader understanding of the American healthcare system and the potential pitfalls and shortcomings of the system. This allows me the ability to be involved in policymaking process, therefore to better improve the lives of our patients. We owe it to them to make sure that our healthcare system continues to work for them and meet their needs. It also is important to understand that hospitals need to remain profitable for their services to the community to continue. Finding a balance to where both the patient and the hospital are satisfied is key to a smooth running system. Biblical application to the APRN role. I really appreciated the added application of stewardship found in Luke 10:33. We as APRNs can aid those in need daily. The Good Samaritan only had, he may not come across somebody in need on every day, but we as healthcare providers, we will be guaranteed to come across someone in need every day, and it's our job and it's our mission really to serve them. You'll never know what kind of impact you'll have on the life of another person. Another thing that just kind of sticks out to me is following the golden rule stated in Matthew 7:12. In everything, do to others what you would have them do unto you, for this sums up the law and the prophets. Patients and their families can be very frustrating at times and high need, and in some cases they may be, not on getting on your last nerve, or they may be demanding and frustrating and entitled in some certain situations. But to keep the golden rule in mind, following these principles allow healthcare providers in general to provide the best care possible, even in challenging situations. And I believe that what we do is a ministry, no matter what field and specialty you're in. I pray the success for everyone else, and thank you for taking the time to listen to my presentation.